Hello, this is our video on confidentiality. What do we mean by confidentiality? Patient information is a secret. So, confidentiality is a physician duty to protect the patient information and not sharing his information without a consent, without a patient consent. Uh, in every exam, they will bring a scenario. Here is a common scenario we will discuss now. What to do when to break the confidentiality. This is a question. So let's discuss it one by one. First scenario, which is common, psychiatric patient tell you that he will kill himself, suicide. What you will do? If you are sure that he will do it, you have to tell his family. Also, authorization or authority. Another example, which is very common, patient tell you that he will kill his girlfriend or a third party or other person. If you are sure that he will do it, you have to tell the authority, and also you have to tell the person. In this example, his girlfriend. This is very, very important. But you have to be sure first before telling the authority or the third party. This is called the duty to warn and protect or permission to warn. I hope you get this scenario. Third scenario, which was also common, patient developed epilepsy and he drive. Here, not only the epilepsy, patient blindness, brain tumor, fits of any kind that will affect his driving and could lead to accident, and so you have to report to the authorities also this problem. In any scenario, patient drive, get epilepsy, you have to warn about it. It is also okay to break the confidentiality. This scenario, patient in emergency after car accident. Uh, let's say his family calls the hospital asking about him. It's okay to say that the patient here in the emergency, but don't give any medical information about his condition. So you can locate the patient for his family to come. Uh, this scenario, patient in the ICU and his family came asking about the diagnosis or about his condition or whatever. You are not allowed to tell specific information about his condition except if he give a consent for you to tell. In the exam, they will bring it many way. His family are very sad about him. He will die soon. You must share the information. No, this is a confidentiality. Don't tell. This scenario, patient with salmonella, TB, syphilis, cholera, whatever communicable diseases. What you do, you must tell the authority. Anyway, the lab in the hospital will tell the authority, but you have to understand that if any communicable diseases, you have to tell. The scenario here about patient with HIV, what to do? Okay. Patient with HIV, here they ask about will you tell his girlfriend, her sexual partner, or you will not tell? You should tell, but first you have to encourage the patient to disclose for his girlfriend. This is the question. Encourage the patient. If the patient refuse and you are confident that he will not tell the patient, tell his sexual partner you have to do to protect the sexual partner, to protect his girlfriend, boyfriend, or whatever. So first, encourage the patient to disclose. If he refuses, you have to tell his girlfriend. Next scenario. Next scenario is about child abuse. If you suspected that there's a child abuse, like someone hit this baby or there is an injuries on his body, and you suspect it, you have to report this condition to Child Protected Service. But before, you have to speak with the patient in private, whether a child here in this example or elderly abuse in the next example. Some doctors are afraid if they will report child abuse, they will be liable for lawsuit or something like this. Don't worry. You have to report. If you are not correct, there nothing will happen for you. So first, speak with the patient private. Second, report for child protective. Also in the elderly abuse. Here is this common example. Patient in psychiatric facility or in bring it with came to the hospital with a bruises or whatever, and she is afraid to speak. You have to discuss with her to try to understand what happened, but be sure it is private, not if the caregiver was there. If you suspected any abuse, you have to tell Adult Protected Service. This example is about what if the patient came presented with gunshot wound or something like this. You have to report this condition. And also if the patient die from the wound or something like this, you also have to report. If the patient die from a wound, you have to report this to the authority. Circle of care. What is the meaning of circle of care? Circle of care, it is a group of the physician, nurses, pharmacists that are dealing with the patient condition. Like if the patient need family physician will be inside the circle of care, his nurse, his other doctor, all of this inside, the pharmacist. And here is a common example for the circle of care. Patient came to the hospital with MI. All the patient came to the hospital with MI. He don't remember his medication. You can't get contact with his family physician, but so you called his pharmacist to ask about the medication for this patient. The pharmacist should tell you what is the medication this patient take, because you are inside the circle of care. I hope you get this idea about the circle of care. Thank you very much.